Welcome. I hope you've all had a chance to get a lunch. I'm really pleased to be here with my colleagues and partners, David Entwistle, President and CEO of Stanford Healthcare, and Chris Dawes, President and CEO of Lucile Packard Children's Hospital and Stanford Children's Health. And this is our annual town hall meeting where we have an opportunity to give you an update on the exciting work that's going on across Stanford Medicine, and also, very importantly, give you an opportunity to ask us questions. So I'm going to give a brief overview, and then David will come up to the podium, and we'll talk about the work that we're doing with integrated strategic planning. And then following David's presentation, Chris will give an overview of this exciting and amazing new children's hospital that we're about to open in the very near future. And then we'll open it up to your questions. So first, I wanted to describe a few of our new collaborations and initiatives that have come about since we last had a large forum like this. In January of this year, we launched a Center for Digital Health, really to bring together the talents from around Stanford Medicine, the two hospitals plus the school, but also around the university, to bring together those talents to focus on the opportunities presented by digital health. And there are really sort of two fundamental, there are many, but two fundamental categories that we see in digital health. First are the consumer-facing devices that furnish each of us with a lot more information about our health and potentially furnish us as healthcare providers a lot more information about the health and lifestyle and well-being of the people who entrust their care to us. So that's one bucket. We might call them healthcare enabling, consumer enabling devices. And then a second area is how we extract information from the treasure troves of data that exist out there in electronic health records that also exist and are coming in from these consumer-facing devices. And we've got experts and exciting work going on in both of those areas, as well as at the intersection of those areas. Also, this calendar year, we launched Project Baseline. We've talked about that before in meetings such as this, but Baseline is being supported by Verily. Verily used to be Google Life Sciences. Now, when Google became Alphabet, Verily became a corporate entity within the Alphabet structure. And Baseline is a 10,000-person longitudinal cohort study. 5,000 people enrolled here in the Bay Area and 5,000 in North Carolina near Duke. And everything that you and I can imagine about their health is being studied and determined and followed. The initial commitment is for a 4-year follow-up period. And we should be able, for the first time, to really get information about the predisposing factors for diseases. So we like to think of this as being this century's version of the Framingham Heart Study. Except unlike the Framingham Heart Study, it's being done in a demographically, racially, and ethnically balanced way. And we really hope the conclusions from this will help to empower and drive our efforts in precision health, to understand the determinants of health as well as the determinants of disease, and therefore be able to predict, prevent, and cure disease much more accurately. And the third project I wanted to highlight is the newest one, just launched last month on September 12th at the Apple special event. And at that event, Jeff Williams, the Chief Operating Officer of Apple, talked about and announced the Apple Heart Project. We, Stanford Medicine, are very pleased to be collaborating with Apple on the Apple Heart Project. You know, the Apple Watch is today the most commonly used heart rate monitor, and it also can be used to detect cardiac arrhythmias such as atrial fibrillation. And we know that atrial fibrillation is a predisposing factor for stroke. So in the coming weeks, there'll be an app rolled out that will allow people to gain more information about their heart rate and about the potential of arrhythmias, and then allow us to study that information in ways that hopefully can improve health. So 3 exciting initiatives among many, many others. Diversity and inclusion remain a significant area of focus for us and always will. We've done a number, I think, of exciting and impactful things since we last met in a large forum like this. In the spring, in collaboration with Dean Elizabeth McGill at the Stanford Law School, we hosted a conference here in LKSC on race, policing, and public health. This conference brought together over 300 people. There were law enforcement professionals, psychology experts, really to talk about the enormous problem we have in our country today of policing and violence and the shootings of unarmed individuals, what the predisposing factors are, and what can be done to address that. Also, just a few weeks ago, we opened a new facility in the Lane Medical Library, a beautiful facility, which goes by the acronym DCORE, Diversity Center of Representation and Empowerment. This is a space that allows anyone in our community to convene in a safe and respectful way to talk about topics related to diversity and inclusion. And I'm really grateful to our students. Pictured here is Tawam Lucas, a graduate student in neuroscience here, PhD student in neuroscience here in the School of Medicine. I'm really grateful to our students who came up with this idea and who helped us to design it in a way that will be most meaningful to our community. And then also, just a couple of weeks ago, Dr. Michelle Berry, the Senior Associate Dean for Global Health here at Stanford, led a conference. She and her team led a conference on women leaders in global health, bringing together over 400 leaders from around the world to talk about women in leadership positions and how we can support the development of their careers and the impact of the work that they're doing in the area of global health. We also, of course, every year welcome new students and welcome new faculty members. And this is always an exciting time for us to see. We welcomed 116 new PhD students, also master's students. We're really beginning to see in our student body the outcome, the benefits that our efforts and our focus on diversity and inclusion are achieving. So in this year's entering class of PhD students, 25% are from underrepresented groups. That's compared to 12% in 2012. In this year's entering medical school class, 25% are from underrepresented groups. That's compared to 14% in 2012. So it's really wonderful to see the time and effort and devotion that so many of us have focused on this really coming to the benefit in terms of the students that we're attracting to Stanford. And we remain, in fact, even more so than I think ever before, a very attractive institution where students want to be and want to learn. And I think we're building an affirming community that's inclusive and representative of everyone. We also launched a new Physician's Assistants Master's program this year, enrolling 27 students in this exciting new program. They're learning right alongside of medical students, and it's an amazing group of people who are dedicated to health and healthcare and public health. And finally, we welcomed some new faculty leaders. Among those, Dr. Leslie Subak, our new chair of obstetrics and gynecology. Leslie's not new to Stanford. She received her MD degree here and then went up to UCSF to do her residency, stayed on the faculty, developed a very distinguished career as an expert in pelvic floor disorders and urogynecology, as well as in public health related to gynecology. And we're just absolutely delighted we're able to attract her back to her home here at Stanford to be our chair of obstetrics and gynecology. And also, beginning on September 1st, Dr. Tate Shanafelt joined our faculty. He'd been at the Mayo Clinic. Many of you have heard and read about the emphasis we've had on focusing first on physician wellness and well-being, but then more broadly on the wellness and well-being of everyone in our Stanford medicine community. Tate is recognized, I think, as the leader in the country of initiatives related to physician wellness. You know, today we see data that show over half physicians in our country are burned out by a variety of different metrics. We have an alarmingly high suicide rate among physicians. And Tate has really been the leader nationally in research and in driving a change in those outcomes and in that environment where he was at Mayo. And we're delighted to have him leading our WellMD Center here and working really with all three entities in Stanford Medicine: School of Medicine, Lucile Packard Children's Hospital, Stanford Children's Health, and Stanford Healthcare. So let me now turn it over to my colleague, David Entwistle, who's going to tell you about our integrated strategic plan. And then following him, Chris Dawes will tell you about this wonderful new children's hospital that's about to open. Thank you.
Well, I appreciate you coming today. I know taking the lunch hour and having the opportunity for us to share a little bit more about some of the things that we're working on. And I always get excited when I hear Lloyd talk about some of the things that are happening here at Stanford. It actually was about a year ago, a couple months, that I was up here for the first time, just learning about some of the exciting things that are happening. And I never cease to be amazed by some of the things that we have going on, and some of the science and technology. So I wanted to touch just for a minute about what we're doing in terms of our long-range planning. What are we doing to say, and I like the title of this because it says the Integrated Strategic Plan. So what does that mean? What are we, as not only Stanford Healthcare, but also Stanford Medicine and Stanford Children's Health, working on together? What is our strategy in terms of the way that we will approach looking out over the next 5 to 10 years? And there's a lot of exciting things that we have going on and a lot of great work that have gone into that. In fact, I want to share with you a little bit about some of the things that we've actually been able to discover in that process. Many of you, and I appreciate the fact that many of you responded, we sent out we sent a survey out to actually everyone within Stanford Medicine. We had about 3,700 responses. You can see on the chart here, we had probably about 70% of those came from the frontline staff. As you can see, the 25%, and I probably ought to read here so my vision is a little better, 20% on that middle level, and even as we look at the 10% of senior leadership. The reason to do this is to have that opportunity to really get a broad base of feedback in terms of what you see is important for us to be working on and what you see as that strategy. Because we think about what is going to drive this organization and what we feel is important. It's sometimes easy because we are Stanford. We have a lot of ideas. There's a lot of things that we're working on. I love the comment sometimes it's called 1,000 flowers blooming, and sometimes all at once. And so there's a lot of things that we could be doing and could be sharing. But part of this is to say not that we're not going to do the exciting things that we're doing in the research and the sciences and the things that lead to the amazing discoveries that, quite frankly, draw patients here. But what are some of those things that we do need to focus on as we differentiate ourselves in some of the care that we're able to provide? And so a lot of great things that are going into that. Also, we've actually formed 13 working groups. We actually had the opportunity this weekend to have several of those working groups present some of the findings. They continue to not only do their work as individuals within these groups, but really seek additional feedback. And so part of what we want to do is to say, are we inclusive in everything that we've asked? Are you having that opportunity to be able to give feedback to us on the things that you think will shape our future? And so we actually went out. We are a YouTube generation. We love videos, at least I do. My 16-year-old shows them to me all the time. He goes, "Dad, you're doing it wrong. Here's the video on YouTube. This is how you do it." There's a lot of great opportunities for kids to give you feedback. You know that well, too. But I want to show you, because we actually asked some of our organization to share with us what is going on and what does that integrated strategic plan mean to them and what feedback can they give us. Let's watch.
Stand at the T.
Do you want straight on?
What is the integrated strategic plan?
What a great question. I knew you were going to ask.
The integrated strategic planning process is a very ambitious endeavor.
It's people coming together and saying what is the most important thing for us to do next, what are our challenges, and how can we best face those.
To our patients and families, we're Stanford Medicine. We are one enterprise.
It's the strategy of the School of Medicine, the adult hospital, the children's hospital, not as 3 different strategies, but as a unified strategy. How are we going to work together as Stanford Medicine?
It's going to address everything from promoting fundamental discovery all the way to healthcare delivery models in this changing environment.
But it's more than just a plan, it's a vision. It's how you're going to get there.
It's the way that we are going forward, being inclusive, asking questions to figure out the goals.
Are we doing the right things today to move us to where we want to be tomorrow?
I think where we are is great. It's not planning for today, but it's planning for the future.
We will align our vision, we will be cost efficient, we will have shared resources.
And if we can offer up all of that, I think we will have been successful.
It's really moving from a position of strength. And I see us being number one for the indefinite future.
This is an opportunity to actually have a voice in how we deliver on that mission.
We want to hear people's thoughts, so reach out to people that you know run working groups, chairs, division chiefs.
Have an opinion and share that opinion.
We're a leading academic institution. I think we have an obligation to make a difference in the world. How can that not be important?
Okay.
You've asked some good stuff, including stuff I wasn't prepared for.
Well, I hope you got a pretense for some of the work that's going on. But more importantly, I hope you heard what we feel is important, and that is share your thoughts. And so we have up here the web address where you can actually see some of the work that's actually going on. We also have the email address so you can share your thoughts with us. And there's been a lot of great ideas that have come out. But in that integrated strategic plan, how can we capture those things that we really will set a tone for what we're going to be doing in the future that will continue to differentiate Stanford? So please take the opportunity to share that with you, or share that with us. So with that, now it's always hard to follow or be before the person that's talking about the kids' hospital, because they have all the fun slides and the fun things. But we have a little bit of an exciting event coming up in relation to our children's hospital. And so let me turn it over to our CEO of the Children's Hospital, Chris Dawes.
Thanks. Well, it's a real pleasure to be here today and to share with you our new Children's Hospital, which we are scheduled to open on December 9th. We've had some issues here and there, so we're going to make the final decision of the go, no-go at the end of this month. And what issue you may have heard about is that we had a subcontractor working on the sprinkler system, and he was making some adjustments to it, but he didn't turn the water off. So it flooded our telecom room, of all places, right? That was 2.5 weeks ago. So we've now replaced all that equipment and so on and so forth, and the insurance company is paying for it, so we're not paying for it. But anyway, these things happen, and so if everything's looking good, we'll get it licensed in the month of November, and then we'll open in December. So what I wanted to do today was to share with you some aspects of the hospital.
Lucille Packard Children's Hospital Stanford isn't like most hospitals. Because Lucille Packard, well, she wasn't like most people. Lucille, or Lou to her friends, volunteered at the Stanford Convalescent Home for Children, where she discovered her passion for helping kids. Becoming a mom only made Lou more passionate about children's health. She recognized the need for a children's hospital with world-class care for all children.
Now, back in the 1980s, when the original hospital was being designed, my mother traveled all over the country looking at other great children's hospitals. Her focus was to talk to the families and children and caregivers to make sure that we could design a hospital that provided the best care to treat the whole child and not just the disease.
Lou believed in the hospital and our community so much, she and her husband David pledged $40 million and asked the community to join them.
As a nonprofit hospital, our community's philanthropy has allowed us to take care of all children who come to us for care, regardless of their ability to pay.
In designing the new hospital, we engaged not only our staff and our physicians, but also our patients and families.
Part of loving our children is protecting the planet they're going to grow up on, and this hospital was designed to be as environmentally sustainable as possible.
We are now the most technologically advanced, family-friendly, and environmentally sustainable hospital in the country. Without you, we simply would not be able to provide the kind of care that we provide.
From one girl's dream, to one mom's vision, to an entire community's commitment, welcome to your children's hospital.
Well, I was supposed to give you a little intro, but I pressed the button too quickly. But anyway, I think you can see a little more information about our founder. Lucille was an incredible visionary and really worked with the architects and so forth to really design a hospital that had features that was as home focused as possible. And as we move into the new hospital, this is the entryway to the new hospital. Susan Packardor, her daughter, led the design committee of the board of directors for the new hospital. And when you look at this facility, we wanted to create a place not only that would obviously cure disease or address disease, but also a facility that would be nurturing and would feel comfortable to young children and their families. We wanted to make sure that we had a facility that was not institutional. And we've conducted many, many tours over the past few weeks, and the feedback we're getting is that it is not an institutional hospital type environment. So that was one of the key aspects. Now, another one of the key little fun things we have on the first floor was called a story corner, and this is an interactive screen that kids can get up in front of and grab fish and so on and so forth and move them around, and it's really a fun thing. Then we also wanted to make sure Susan Packardor is very much interested in sustainability, and so she wanted to make sure that we had a facility that was really conscious of energy utilization and so forth. This hospital uses 30% less energy than the typical hospital because of the way it was designed. We also wanted to create open spaces for families and ambulatory children. And so we have this wonderful garden, which we call the Dunleavy Garden, which was donated by Bruce and Elizabeth Dunleavy. And it has all kinds of play structures and so forth, designed specifically, obviously, for kids. We also, being a children's hospital, spirituality is obviously also very important. So we had a wonderful donor who donated the chapel, or we're actually calling the sanctuary. And the reason we're calling the sanctuary, because we want to make sure that it can be utilized by all religions. And we have 24/7 availability of pastors, and they cover the whole spectrum of religions. And it's a wonderful, quiet place. And then on the nursing units, we wanted to make sure that the nursing units were airy and open and were very conducive to providing the care, not only for our patients and their families, but also for our staff and our medical staff. And as you can see, the edge of the nursing station, there's a little scoop that's designed actually after our current hospital, because Lucille Packard wanted kids to be able to see over the counter, and that was one of the features we built in. Plus, those little circles, you can't see them, but they have little pictures of animals and so forth in that as well. Actually, let me just go back to this. We have team rooms in the middle of the unit, and they're designed to bring the providing teams together. both our physicians and nurses and so forth. They've got a divider so they can create a quiet zone and a noisier zone, but it's really designed to make sure we come together as a care team. Another aspect that is really important for our children and so forth is to have ways to distract children from when they get shots and when they're going into an MRI or something like that. So our anesthesia and other faculty have created this virtual reality program where these kids can look on this screen and get distracted and so forth. We had one child who unfortunately had to go through some very, very painful procedures, and was every time a nurse or doctor walked into the room was screaming, and so he was about 10 or 11 years old, and we fit out this device and he was able to relax and go through the procedures without all the anxiety he had before. And then Dr. David Axelrod, who actually is right there, he, along with others, designed using virtual reality for designing a way to look at the heart and to teach medical students and faculty how to look at various aspects of the heart and how to perform various procedures on the heart. This was developed over the past year and was recently spoken to at a conference by Mark Zuckerberg, who referenced this specific device. We also, actually, I have to look at my notes on this one. We also developed HIFU along with Stanford Healthcare, which is a high-intensity focused ultrasound, and we're going to be one of the few centers in the United States to offer this to pediatric patients. We also developed, we installed a CT scanner, SPECT scanner, but as you can see, we're trying to make it more friendly to kids. We've got a ceiling with sparkling lights, stars and so forth, and then around, you can't see, on the far side, there's a whole mural of San Francisco and so forth. So it makes the room a little less scary for kids to go into. Now I'd like to share with you the second video about a parent who talks about the new facility.
You were such a cute baby.
Actually, it was on my forehead.
Yeah, you had a sticker on your forehead.
One of the best parts of my job is getting to connect with patients and families and feel like I'm making a difference. Making life normal for kids in the hospital is one of the biggest challenges, but it's also one of the most satisfying parts of the job. Anything that you can do to reach out to that kid and bring out their personality helps them to cope with what's going on and ultimately do much better because they feel better about themselves.
Tyler loves to be inpatient. He thinks it's a great game that he can come in and see all of the nurses and the wonderful medical staff who treat him. Everybody here has treated us wonderfully. We've got so many people who are almost like members of our family now. Walking into this room, it's spectacular. It's large, it's spacious, there's enough room for our family to really move in and make ourselves at home.
This hospital was designed to be able to prioritize patient needs. The floors are specifically designed to be softer. There's wood paneling in the patient's rooms to feel more like home.
I'm really looking forward to this hospital providing more hope. There's so much hope to be had, but with more bed spaces available, Packard will be able to treat more families, and more families will get to take their kids home and watch them thrive and grow up into healthy, delightful human beings. Really, you've given us our child and you've given us hope for his future, and there's nothing more we could ask from you than to have this beautiful boy who really is thriving because of everything that this team has done for us.
So that's, I think, tells you all that we really wanted to design a facility that really could facilitate that kind of care. And just to briefly tell you about the patient rooms, so we have, the patient rooms are divided into 3 components. There's the first aspect when you walk in is where the providers work. That's where there's counters and so forth. Then obviously there's the patient bed for the patient. There's a big TV. And by the way, when a nurse or a doctor or anyone walks into the room, it will display who walked into the room and whether a doctor, a nurse, or whatever. So that'll pop up on the TV screen. And then on the far side, adjacent to the window, is a double bed, so we can have 2 parents stay the night. They have their own TV and a little curtain to give them some privacy and so forth. Then outside every room is a flower box, which was something that Susan Pacadora insisted on. We wanted to bring the gardens back into the patient rooms. So that's how the rooms are set up. Now, we are moving forward with training, and about 83% of our staff have gone through their initial training. We've also had over 275 physicians who have also gone through training as well. And then we're doing department and division by training as well. We also have had, we're going to have 3, we've had 2 so far, what we call Day in the Life. And that's when we have 300 to 400 people come over, they go to their work areas, and they actually go through all the workflows. Some of them are patients and so forth, and they really test everything. You know, how long is it going to take to get from one area to another? They test the equipment and so forth. And we've had 2 of those, and we're going to have 1 more in November. And those have been very helpful because, number one, it really gets the staff oriented to their new environment. But also the other thing is that it identifies things that are not working. So that's a real plus. Let me conclude by saying, so this is the new hospital on your left, and the current facility is on your right. And we're going to call the new hospital the main building, and we're going to call the current hospital the West Building. Now, what we're doing with the West Building is several things. First of all, we're going to be converting all OB beds into private rooms once we move into the new facility. So all of our obstetric beds, postpartum beds will be private. Now they're not. That will happen by the end of 2018. We're also going to be moving 20 NICU beds into what is now currently CVICU, so that will be upgraded, and that will be moving into there about April. And then we're going to start a whole process. One more thing. The BASS Center, which is our cancer program, inpatient and outpatient, the inpatient component will be moving to the 5th floor of the new building in the summer of 2019. Right now that is shelled, but we received the funding to complete that. So our HEMONC and stem cell divisions will be moving into the 5th floor in summer of 19. And then we're also going to start a process to completely upgrade all of our delivery OB areas as well as our nurseries. And we really want to turn the current facility into a mother-baby center. Now, there will always be certain pediatric patients in the hospital because the new facility doesn't have enough beds for all of our pediatric patients. So there will be patients in both. However, we want to create this mother-baby center over the next few years. So again, it's my pleasure to share this with you. If you have any questions, just let me know. Thank you.
So we have microphones. Please, questions, comments?
Lunch was too good.
It's not usually a quiet audience, but please.
Hi, so I'm Jewel. I'm one of the fourth-year pediatrics anesthesia residents.
Hi.
There have been more and more kind of anecdotes coming out about ICE agents coming to hospitals and arresting either family members or patients regarding their immigration status when they're in a vulnerable position trying to seek out health care. Is there any movement towards making Stanford and Packard Children's a sanctuary hospital and kind of emphasizing that to staff?
I can speak in part to that. We don't allow ICE into the hospital or any of our facilities. So we've never declared a sanctuary per se, but we absolutely don't let them into the hospital. And we've never had an issue with that to date anyway.
I think in the new children's hospital it will be specifically easier as there's only one non-badge entrance, and that will go directly to the front desk. So it seems like it'll be easier to contain, but I know the adult hospital has many more entrance egress points, and I'm just not sure if there's kind of recognition that anyone who's on our hospital's campus cannot be without either being a patient or a family member or having a specific warrant to be on our hospital's premise.
Yeah, I mean, certainly one of the challenges of our facilities is multiple access points, and it's certainly, I mean, that's not only a challenge, certainly from a security standpoint, but it's also necessary just because of the amount of people coming in and out. We would have a lot of feedback if we started locking the doors. But back to your question, though, really, at the end of the day, patients who are in our facility are under our care and under our responsibility, and until they are discharged from the hospital, we have the onus to care for them, and quite frankly are legally required to care for them. And so we would be hard-pressed to allow anybody to come in and take a patient out of our care, quite frankly, for not only for the patient, but the care that they're gaining from us. So it's really not an issue where I'd see we'd allow folks to come in and be taken because they're under our care.
Hi, I'm Heidi Feldman. I'm a Division Chief of Developmental Behavioral Pediatrics in the Department of Pediatrics. And following up on questions about the socio-political environment that we live in, there's been a lot of talk of destabilizing health insurance markets, changes in Medi-Cal, and all of this covered California maybe would be underfunded. So all of this can have profound influences on our institutions. I wonder what we're doing to prepare for changes in the financial supports that we get from insurance and Medi-Cal.
Maybe let me start, if you don't mind. Let me first say, let's try to prevent that from occurring. We have had literally an onslaught over this last year. We've had 3 specific bills and provisions that have taken, quite frankly, would be challenging, if not catastrophic, if you think about Medi-Cal in the state of California. If you look at the last Graham-Cassidy bill, Graham-Cassidy was proposed to, in essence, take out $275 billion out of what was being used for basically Medicaid. $95 billion of that actually would come out of the state of California. So you look at what kind of impact that would have. Roughly a third of all patients, or a third of all individuals in the state of California, are under Medi-Cal in California. So the percentage within the adult hospital is not near as high, quite frankly, as what you see in the children's hospital. So we have taken a very active role as these bills are coming about. Not only have we reached out to state senators, we've certainly reached out through our local congressmen and really taken an active strategy to do that. Now, what if one of these, quite frankly, gets through? And we're going to continue to see the onslaught of that. Every time one of these fails, they say, oh, we're going to focus on taxes, but yet then we see something come up like Graham-Cassidy. So I don't doubt that we're going to continue to see these challenges, and we're going to continue to be very active advocating against them, not only on a local basis at Stanford University and also on national boards that we sit on and advocate through. But at the same time, there's things that we can do to prepare. We are challenged because we are in a very high-cost market. We also have a case mix index of 2.6, which makes us also a very expensive place to get care because we have to have a lot of resources. But there's a lot we can still do to prepare, and I think that was at the end of the day the question, to say, what are we doing as an organization to prepare? We've talked about what we call our value equation. Our value equation is to look at what's the experience our patients have so that they still want to continue to come here, what's the quality of care that we give, but also what does that cost. And we feel that we have to continue to position ourselves in this market that patients want to come here. Why is that important? It's important certainly for the hospitals. It's also important from the research side for the folks that we actually accrue to trials, but it's also important in terms of the teaching environment that is students. So we'll continue to not only advocate against some of these bills and what they're having, but also making sure that we're positioning ourselves as an organization as a continued great place to come.
I would just add to that, in terms of pediatrics, 50% of the children born in California are on Medi-Cal. At our campus is about 45%, and about 42% of our patients are Medi-Cal. So any dramatic drop in Medi-Cal payments will certainly have a profound impact on our ability to serve all patients. And so I agree with David. Our first initiative is to try and prevent these changes from happening. Back in 2008, when Obamacare was starting through its process, I was chair of the board of the National Association of Children's Hospitals. Now that's a new entity called Children's Hospital Association. I'm the co-chair, the national co-chair of a CEO group that is actually focused on developing strategies to prevent changes to Medicaid funding, and also to make sure that the Children's Health Insurance Initiative goes through, which is called CHIP. And so we're very, very active in trying to make sure that we ensure that Medicaid stays intact. Having said that, in this political environment, I think we all need to expect that there's going to be other grabs to try and change that. So we do need to have some preparation. And we're one of the most expensive children's hospitals in the country, and we just, in the last 6 or 8 months, we actually reduced our expenses by $55 million. And we're going to continue to look at ways to become more efficient. We want to provide the same level of care. We will always provide care to all children, regardless of their ability to pay. But we do need to look at ways of being more efficient and looking at our pricing and so forth. So we have to do both. We need to continue fighting aggressively any changes to Medicaid, and at the same time, we need to prepare ourselves to be more cost efficient.
Maran Timurtash, Stanford Healthcare Finance. Every member of our community sitting in this room and of course around campus, we could all be advocates, ambassadors for the Stanford Medicine umbrella. Are there plans to leverage us to further, to advocate, to do what we can, not in an organized fashion, but perhaps in other ways to get the message of medicine and Stanford in the Bay Area, in Northern California, in the networks that we all belong to, for example?
Yeah, I'd love to. You know, one of the things, and part of the reason I threw out a request as part of our integrated strategic planning is I hope that we all as an organization become advocates for what we want to see as our long-term vision and where we're headed. And so I hope we all take the opportunity to do that. I also hope at all times and all places that we're advocates for Stanford Medicine in the community, maybe because of the role I'm in, but I often get to speak when I'm in events about hearing about wonderful things that are going on. But I hope we're taking the opportunity to be visible about the things that are wins in our organization, the great science, the great things that we're working on. As we get the position to be able to roll out the strategic plan, that's another area I hope that we can all be advocates for creating part of that vision as an organization. I think one of the toughest parts to do, and whenever you have a strategic plan, is just having it sit on the shelf. The question is how can you get that throughout the organization? And so I hope we can all become advocates of what we see as the vision for our organizations into the future.
Well, maybe I'll ask a question, my two colleagues. Lots of exciting things going on and lots of challenges in our world today. And as you look in this coming academic year, what are the things that you feel are most important that for all of us to keep in mind? David, could you share some of the things that you think about on a daily basis in terms of priorities and the great things that are going on at Stanford Healthcare and Stanford Medicine?
You know, one of the things I get challenged by is you think about how well we're doing, and I think there's a lot of things that we do really well. I think one of the challenging parts, and when I think about what keeps me up at night, is quite frankly when we do things too well. Because what I worry about is who's catching up to us around us and who's doing those next innovative things. And there's some incredible things that we're doing as an organization. If you look at the experience that our patients say that they're having come into the organization, it's incredible to see what patients say. As I was just alluding to having the opportunity to be in the community, I had a patient's family member the other day grab me and says, "Are you the CEO of Stanford Healthcare?" And I said, yes. And so you worry a little bit about that question because you wonder what's coming next. But I have to tell you, I couldn't even get a word in edgewise for the next 5 minutes as he told me how amazingly wonderful our caregivers were in treating his mom. And I have to tell you, it just touches my heart to see that. But I also think about, along that question that you asked, Lloyd, what are we doing to make sure that we're always continually pushing that bar? To make sure patients are not only getting the best care, which I feel Stanford is the place to get that, but how do we also make sure we create that experience? Because others are catching on to some of the things that we're doing and trying to catch up in those environments. But there's a lot of things that we want to push the bar on and continue to improve on.
Chris, your thoughts?
Yeah, I shared this the other day with a similar group. I think that one of the things that I'm concerned about is that we deliver on our promises. We're Stanford. I think the community has a very high perspective on what we do, and sometimes that is higher than what we can actually deliver. And so I think that what I worry about is to make sure that we are living up to the promises we make to the community and the community's expectations. So I think that's a really important thing, and we have to do it every day, every hour, every minute of every day, because or at least when we're at work, because we need to make sure that we are delivering on that promise. And we do make mistakes from time to time, and some are really minor, and some can be really devastating. So what I'm concerned and worry about is to make sure that we're living up to our promises. We have the systems in place. We have the capability to deliver what we have said we will deliver on.
Well, Lloyd, what did we miss in our answers?
I think you covered it really well. I think that we have such incredible opportunities here, and it's fortuitous that we're doing this integrated strategic plan in Stanford Medicine at the same time that the university is looking at its long-range plan. And what excites me so much about being here is that we are a part of this great university. We have interactions with the other Stanford schools. We have these wonderful new facilities that are coming online. And I think we all share an enormous enthusiasm for what we can accomplish here. I don't think there's any other academic medical center that has the type of opportunity in front of them that we do. And I think for all of us, that means we have a heightened responsibility to making sure we're living up to our potential. I also think that in these times of enormous uncertainty in our country, it's really, really important that we do everything we can to build our community. I think this is a really special community. The people in it, the values of the shared values that we have as a community, and affirming to each other in our actions, in our interactions, the value we place on our community, the value we have for each other as individuals and as groups. I think that's really, really important to enable us to be successful internally, but also really to show the world what a cohesive and highly functioning community can do. And that's a challenge in the country right now, and I think places all that much of a responsibility on our shoulders to make sure we're building the type of diverse and inclusive community here that I think we all aspire to achieve. Well, with that, I want to thank all of you. Oh, if another question, please go ahead. I'm sorry. You do? We do. Yes. Please do.
Thank you. My name's Dave Simpson. I'm with Stanford Healthcare Organization Development. And when I first joined the hospital, I noticed all of the cylinders of excellence, right? Not only in the School of Medicine and SHC and LPCH, but within the organizations. Sometimes we call them silos. Wonderful, amazing, excellent silos. In the last few years, I've seen a lot more collaboration between School of Medicine, SHC, LPCH. We have shared services. I'm also hearing today a lot about inclusion and collaboration, and that's the model and mindset I have. Do you want to say anything more about that and where you see our mutual collaboration, shared goals, shared knowledge, communication, and problem solving together?
Well, I can begin. I feel it also, and I think it's absolutely marvelous. And I have the privilege of working every day with David and Chris and our larger teams. And I think we're very much are committed to building those types of interactions and collaborations, breaking down the silos. I think it begins with us as leaders and then with those around us and with you and your colleagues. There is so much more we can accomplish together in a collaborative, cohesive way, and we'll be so much more effective as individual entities and as a collective by embracing that. And I, too, sense the enthusiasm in the movement. So thank you.
Well, what I'm really glad is that you're picking up on that. I think, certainly as Chris and Lloyd and I talk about, and what you see with this even integrated strategic planning process, it is very easy, as Lloyd and Chris and I even are involved in things around the country. How many folks are very siloed in their approach and style? And it's not, sometimes in academics, it's easy to take different approaches and be sequestered off to your own group and not coordinate back. I have to tell you, with our group here, it is a constant opportunity for us to work together. And quite frankly, that's going to be what leads to our success. I will tell you, sometimes as I go sit with some of my CEO colleagues in other academic medical centers around the country, I keep thinking to myself, I'm so glad I'm here. I mean, that ability to work together and collaborate is core and inherent to who we are. And I think us being able to build on that only makes us successful in the future.
I would just add that having been here for several years, I would say we are in an era right now of more collaboration than I've ever seen. So I'm glad you picked up on it. Thank you.
Other questions? Well, if not, thank you all for sharing a part of your day with us, and we'll stay in touch, and please do give us feedback on how we can keep you informed and receive your input. Thank you.